So how important is thyroid management when your thyroid is persistently, chronically low? Is there such a thing as thyropause? Like menopause, your thyroid just runs out of steam. Is that a thing? Well, as it turns out, thyroid disease is very prevalent in women, and it's very prevalent in women as they age. So our thyroid gland is located right here in front of the neck. It's a very small little butterfly-shaped gland with two lobes, and it makes these very important hormones, T3 and T4. So a lot of people have no idea that the thyroid hormones are composed of a thymine nucleus and iodine. The T4 stands for 4 iodine molecules attached to this nucleus, and a deiodinase, which is an enzyme, will cleave off an iodine molecule, transforming the T4 into T3. Also, a lot of men and women have no idea that T3 is the main active thyroid hormone in the body. It's the hormone that can interact with the cells. It's the hormone that's responsible for day-to-day energetic transactions throughout your body, because thyroid determines the rate of your metabolic optimal burnout of all the calories that you intake in your body. So the metabolic rate is determined by your thyroid pretty much. So these two key pieces of information, T4, T3, what does T4 do? Nothing. It's a deposit source for T3. What does T3 do? Everything. Because that's the key hormone that interacts with your cells. Now, in a normal healthy adult, when a doctor, a conventional medicine doctor, would replace T4 only, would be because they're hoping that the patient will naturally convert. This natural conversion happen very easily in most people when they're healthy. However, when there's inflammation and vitamin deficiencies and other hormonal imbalances, it will not happen naturally. And these people in whom all these other factors are present will have a poor conversion. So the T4 will not work. You have to give them T3, one thing. And then another thing is iodine deficiency is not diagnosed very often. It's also very hard to diagnose because iodine it's a mineral that's constantly replenished, and testing blood iodine doesn't really give you a full picture. So there's an iodine testing urine test, like a challenge dose, where you take 50 milligrams of iodine and we measure your urine in 24 hours the next day. How much of it do you eliminate? If you eliminate all of it, you don't need any iodine. Your iodine is sufficient. You retain half of the iodine